A very good evening to one and all gathered here. And on behalf of NICE Delhi, I welcome you all to this webinar that is on the topic Precision in Diagnosis Enhancing Patient Safety in Healthcare. On September 17th, every year we celebrate the Patient Safety Day, and today, that is September 22, is the last day of the Patient Safety Week. Every year, World Health Organization gives a theme for the Patient Safety Day, and this year we have the theme that is improving diagnosis for patient safety. So it is very important to understand that a great burden has been seen on the health as well as a global impact has been seen because of the wrong diagnosis or because of the missed diagnosis. So this year, emphasizing more on the importance of diagnosis, how diagnosis affects, how right diagnosis can save life, or making a wrong diagnosis can lead to greater morbidities and mortalities. Today, we will be speaking on that. So, we have with us our speaker, Mr. Pramod V. Pramod sir is a graduate in nursing with 15 years of experience in the departments of emergency, OT, and medicine HDO. He is a BLS and ACLS instructor. He is also a quality member in the DCBH hospital. Sir, I welcome you to this platform to share your experience and I invite you to be the speaker of this webinar. Over to you, sir. Thank you.
Thank you, Ashley, ma'am. First of all, I would like to extend my wishes to the NICE Delhi team who has organized such a webinar on this World Patient Safety Day. And you have given me an opportunity to present this webinar. Thank you once again. And I welcome all the participants who has joined here for this webinar. So, the theme of this year, 2024, is Improving Diagnosis for Patient Safety. And the slogan is Get It Right, Make It Safe. Whenever you are making a diagnosis of a patient, all the remaining part of patient care will be on the basis of the diagnosis that you have made. So whenever it is making, we have to get it right diagnosis has to be made, and the patient safety should be should be made. The definition of patient safety is the absence of preventable harm of a patient and reduction of risk of unnecessary harm. It might be an absence of patient harm or the reduction of risk of unnecessary harm associated with the healthcare to an acceptable or minimum range. And or in other words, patient safety is the coordinated efforts to prevent harm caused by the process of healthcare itself from the occurring to the patient. And the statistics globally, it is 1 in every 10 patients are harmed in the healthcare system just because of the misdiagnosis or wrong diagnosis made. And around 3 million deaths are occurring every year. In the low to middle income countries, the death because of the wrong diagnosis is approximately 4%. And among this, at approximately 50% of the harm is preventable. So you people just assume that how much big it is. 4% means 4 out of 10 patients are got misdiagnosed, wrongly diagnosed, and they are dying just because of a wrong diagnosis. And out of this, 50% is preventable. So this is the implication of this webinar, that how we can avoid such kind of errors in the medical field, errors in the patient care. So diagnosis has been described as both a process and a classification. That means we'll be categorizing the patient, whether it is a cardiac patient, whether it is a respiratory condition, whether it is a nephro patient, whatever it may be. We'll be exactly classifying the patient, and we'll be giving treatment to the patients accordingly. So it is a classification as well as a process or a pre-existing set of categories agreed upon by the medical professional to the designated a specific condition, that will be designating a specific condition or a specific diagnosis to the patient. What is the role of diagnosis in patient safety? So first point is appropriate treatment selection. As per the diagnosis that we have made, we can go for the treatment. For example, if a patient is presented with the complaint of fever, rather than giving treating the fever, if we are diagnosing what is the root cause of the problem, we can treat the root cause, and the fever will be managed tactfully. Second point is early detection of condition. If we are timely diagnosing the appropriate condition, we can detect and treat the patient accordingly, and the revival time will be very low. Patient complaints. If the patient know about the condition properly, that means what is the problem, actual problem, in which system or which body part is getting affected, he can understand the problem, he can understand his diagnosis, and he can act accordingly. What are all the precautions that he or she has to take, and he can adhere to the treatment properly, sorry. And the last one is healthcare system efficiency. So in this, if we are diagnosing or we are testing appropriately, unnecessary tests can be avoided, through which we can conserve the money, material, and the manpower. Next one is common causes of diagnostic errors. What can be the common causes of errors in diagnosis? First one is complexity of symptom. Whenever a patient or a person, we can't say it as a patient. Whenever a person is presenting in the hospital with multiple problems, he cannot be able to understand what is the real actual problem. When a patient is with the cardiac and nephro problem, it will be little bit hard to diagnose him. What is the actual diagnosis? It will be little hard to diagnose properly. So the complexity of the symptom may lead to the diagnostic errors. Second one is patient related factors. Whether the patient is able to give proper history, whether the patient is able to communicate properly. Just because some may be using the local languages, and the other person, the physician, or it might be the nurse, he or she is not able to understand the local language that he has used, it will lead to miscommunication, and wrong diagnosis can be made, maybe happened accordingly. Third one is technological limitations. If somebody is having poor quality of supplies, or they are lacking supplies, some hospitals may not have ultrasound machines, or they may not have rapid kits, or any other technological limitation. Somebody may not have this CT scan facility and all. This may also lead to diagnostic errors. Fourth one is human factors like cognitive biases, confirmation biases, inadequate training. If the technician, if the nurse or the physician is not trained adequately, there will be knowledge gaps, and it may lead to diagnostic errors. And the fifth one is healthcare system. If the hospital doesn't have any proper policy or a flowchart of dealing the patient, it may lead to diagnostic errors. Some institutions are facing some institutions are understaffed. They may have a high patient load but less staffs. That also, just because of the patient load, workload, there might be errors in diagnosing. And this is the this is the diagnostic errors, new statistics on diagnostic errors, which was posted in WHO on July 26, 2023. It is written that these occurs in 5 to 20% of physician-patient encounters. There are diagnostic errors that is occurring just because of physician and patient encounters, and upon that, the almost 0.7 percentage are harmful diagnostic errors, and which is preventable. Most people will suffer a diagnostic error in their lifetime. That means almost all the people uh, will encounter a diagnostic error. What are the consequences of diagnostic errors? First and foremost, it is patient harm. The patient will be harmed just because of the diagnostic error. A missed or misdiagnosis is made, and the patient will be treated accordingly, which will be not beneficial for the patient. Second one is increased health costs. Just means if we have advised for a wrong diagnosis, wrong test, and it is of no use, and we can't and the test was negative, so we have to go for the next testing. So it will increase the cost of testing, and the money will be unnecessary used. The third one is legal and ethical implication. So whenever there is a misdiagnosis has been happened, we have to the physician or the person whoever have made the misdiagnosis or the wrong diagnosis have to face the legal consequences also. Last one is public impact on public health. So when we deal a patient uh, and he was misdiagnosed or wrongly diagnosed and was treated accordingly, which is not beneficial. Why? Because it was a wrong diagnosis, and the treatment was given on the basis of that wrong diagnosis, and the patient or the person has not been benefited with the treatment, and that person can excuse me if the patient is contagious, he can spread the infection to the other person in the community also. The next one is diagnostic safety. So the safety of diagnosis and the patient can be done through the early detection and prevention screening programs and their screening programs. That means early detection can be done by the proper history taking and advising correct testing and all, and making a correct diagnosis and treating accordingly. Preventive measures can be taken on the basis of the screening programs and all that we are conducting. We can detect it, and we can make preventive measures also. Next one is use of artificial intelligence and machine learning in diagnosis. There are so many applications are available. If we put some questions to the application, that means use of artificial intelligence I am speaking about. With the help of artificial intelligence, we can easily make the diagnosis without any errors or by maximum accuracy. And the diagnostic tools and software advancement is, we have changed from the basic x-ray to the MRI and the CT scan nowadays we are getting. So this is the advancement in diagnostic tools. Interdisciplinary teams and better communication between the healthcare professionals has to be always maintained whenever we are dealing with the patient. That means if we are communicating with the other team member, that means either it might be a nurse or a lab technician or a radiographer, whoever it may be. When we are communicating with them, we have to maintain a proper discipline and decorum of our health team. It may improve the diagnostic diagnosis and treatment welfare of the treatment and welfare of the patient. Addressing the diagnostic challenges, training programs for healthcare providers. Training programs are CNE and CME that we always used to conduct in almost all the hospitals. And addressing the diagnostic challenge means if a person can't understand the patient's problem and he is not able to make a diagnosis or a proper diagnosis, he has to address it to the senior members or the colleagues that I am not able to do this thing. So we can get help from the others, or we can get help from the knowledgeable people who knows about the problem. Next one is creating a culture of safety and accuracy. So always uh, we have to be alert while taking the history of the patient, and the collected data should be analyzed properly so that we can make the proper diagnosis and the actual diagnosis, which will improve the safety of the patient. And if we analyze the collected data properly, it will give accuracy too. And always uh, we have to keep in mind that patient safety is the foremost priority for us. And the implementing root cause analysis means, that means we have to collect the data. As per that, as per the collected data, we have to analyze it properly, and the root cause should be analyzed. That means, as I have told, when a patient came with the complaint of fever, rather than treating the fever, we have to assess what is the actual problem, because of what he is getting fever. Fever is just a symptom. So rather than giving paracetamol to the patient, we have to analyze what is the problem, where the infection is present. So when we treat the infection, the fever will be subsided automatically. Policy and system improvement and national and international framework for safer diagnosis. Almost all the hospitals have their standard operating protocols. How he have to receive a patient, what are all the history that we have to collect from the patient, and how it should be implemented, analyzed. Then what are all the tests should be made as per the available data. Then the diagnosis has to be made. If we have made the correct diagnosis, then we can go for the treatment protocol. All these things are uh, framed priorly, and we have to work accordingly. So coming to the new innovations in diagnostic procedures, there are so many new developments, new diagnostic procedures are available in the medical profession, medical system. First one is point of care testing. What is meant by a point of care testing? It refers to the medical diagnostic testing performed at or near the site of patient care rather than in a centralized laboratory. For example, I would like to give the example of Lalpath lab, which is most familiar almost all over in India. It have a centralized branch, but it has some collection centers also in different areas. So in the collection centers, they will be simply collecting the samples of the patient, and it will be sent to the main branch, and the test will be performed in the main branch. So the collection centers, we can say it as point of care testing. In Delhi, almost 10 years back, there was the implementation of polyclinic and mohalla clinics. So when there is a main tertiary care or secondary care center, all the people may not be approached the hospital regularly for their visit. their testing, or maybe for consulting the patient. They may not be able to visit regularly, so they can go to the mohalla clinic or polyclinic which is near to their home. They can get consulted, they can give their samples, they can get tested there. If something adverse is reported, then they will get referred to the main secondary or tertiary care center. So this is an example for point of care testing centers. Some key innovations associated with the point of care testing centers are, they'll be having rapid testing devices. That means rapid kit, like RDK, random detecting kit of malaria, MCT, dengue, sorry, dengue, or HIV kits are available. These are the examples for rapid testing devices. Just using these rapid testing devices, we can we can make diagnosis. Either it is positive, then there is no problem. We can give the treatment accordingly. Second one is expanded testing capabilities. That means a single center containing different equipments for testing. A single center which has an X-ray portal, which have ultrasound machine also. They have ability to they are able to deal with the blood samples also. So in a single center, if they can test different things, diagnosis can be made easily. Third one is improved safety features. That means safety features are improved just because of the collection of so many equipments in a single center. Fourth one is user-friendly design. That means any equipment which is easy to use, rather than carrying the heavy equipments. If it is fixed in a specific area and it can be used accordingly, it is known as user-friendly. Fifth one is connectivity and data management. So a sample has been tested in a center, and the result of that test, or that blood test, can be accessed through any portal, or by email, or by WhatsApp. They are getting in the different area. That means the connectivity is maintained properly. Always we have to keep the data confidentially, and it should be transparent to the patient. Next innovation is mobile health diagnostics. That means M-Health. With the use of mobile applications, or with the use of our mobile, that device, mobile phone, we can get downloaded with good applications which is easy to use. That means if somebody has to check the pulse, somebody has to check the saturation rate he have, we can just keep the finger on the mobile camera, and all, we can get the result. Such kind of applications are available in the mobile also. So it can be used for bedridden patient, or non-ambulatory patient, or also can get the benefit of such kind of applications. So M Health is referred as transforming the way healthcare is delivered by leveraging mobile technologies to provide diagnostic services. Couple of key areas are in-home diagnostic services. That means sitting in the inside the home itself, they can get diagnosed. They can assess their different vital signs, etc. Second one is telemedicine and point of care diagnostic. Telemedicine Telemedicine is nowadays, it is very common and familiar. For example, we have Dog Genie, Tata Neo, something like that. So many telemedicine applications, as well as internet services are available, which can be used which can be used by sitting in the home itself. Third one is global health and field management. That means all these new innovations are used for the global health. It should not be limited to any specific public group or any specific demographic area, geographic area. It should be available to all the people around the world. That means some remote areas are there, some remote villages may be there where there is no access to that area. That means there will not be proper roads or infrastructure for developing a hospital or setting up a hospital. It will not be there. In such areas, these kind of mobile applications or point of care testing centers can be implemented and get benefited accordingly. So global health and field medicine is also a key area for M health, mobile health applications. Next one is artificial intelligence. Artificial intelligence in this era is beneficial not only in the field of medicine but also in all area they are using. They are getting help. Means all are getting helped with the artificial intelligence. If we want to search something, if we want to frame a question, if we want to make an assignment, we'll be simply just typing what is our requirement into artificial intelligence sites. That means Bing or Copilot, or with the we'll be taking help of Monica AI. We'll be just putting the datas into it, and we'll be demanding for such a thing, and it will show the results. Same in the field of medicine, in the medical field also, it is used properly for the early detection of specific conditions such like cancer. uh, Traditionally we are using the mammogram for the detection of breast cancer, but there is a chance. That means there are errors in such field, in such mammogram results, but AI can detect the mammogram, detect and analyze the results of mammogram, and it can give almost 99 percentage accurate results. So unnecessary biopsies and unnecessary other tests can be avoided. So these are the points how AI is transforming diagnosis accuracy. First one is enhanced image analysis. That means if we have a X-ray film, we have a X-ray film, we'll be putting it in the AI application, or we have a MRI film or anything, an ECG, whatever it may be, we'll be just keeping it into the application, and it will give almost 99 percentage. That it is not 100% accurate. Anything is not 100% accurate. It can give almost 99 percentage of accurate diagnosis. Second one is predictive analysis. There are specific charts and algorithms that we have with the age, sex, and height, weight, what is the current blood values. So it will be predicting, means applications will be predicting the chances of occurring any cardiac disease or any other disease. These predictive analysis can be made with the help of artificial intelligence applications. And third one is natural language processing. As we have told that, as I have told you that when there is a barrier in communication, it may lead to the uh, mis miscommunication and misdiagnosis. If we put the prescription of a physician into the artificial intelligence application, it will be converting the medical prescription into an understandable language to a person who is non-medico. That means specific words or terminologies which is little bit complicated, which is not understandable by a common person, a layman person. If he is not able to understand, the AI will be converting the language into an understandable language, so that he can understand what is the actual problem, or what the physician is prescribed. Next one is genomic analysis. So there might be genetic changes in the normal gene or the pathogens. There will be mutations. So these kind of mutations can be analyzed with the help of AI. Remote diagnostics and continuous learning. Remote diagnostic, same as of we discussed in the MCT, PCT, that in such areas, in such demographic areas where there is a lack of human access, where there is a lack of hospital, uh, the data can be collected with the help of AI, and it can be assessed through, and proper diagnosis can be made, and facilities, medical facility or any facilities can be provided as per the analytic data. Next one is continuous learning. Continuous learning, like CMEs and CNEs can be conducted through artificial intelligence on the basis of the data available in the intelligence apps. Next one is ethical consideration in AI and healthcare. First and foremost is privacy and data security. All the data of the patient should be kept under security, and the privacy should be maintained. Second one is to minimize the bias and extend the fairness. Third one is transparency. That means what test is going to be being done with the help of AI, and what could be the result, what is the process. Everything should be explained to the patient and the bystanders, and they should get an informed consent from them. Then we will be proceeding to the diagnostic proceeding to the diagnostic process. Fifth one is autonomy and human oversight. That means if AI, with the help of AI, we have made a diagnosis, it should be counter checked by a human. That means a physician who knows about it. That means the machines cannot be believed 100 percentage. So human oversight should be there. And access and equity, accessibility, that means what is the result that and how it can be downloaded from the system. That access should not be denied for the person or the patient. It should that the results and process of analyzing should completely be transparent to the patient, and equity to all the persons should be maintained. That as I said earlier, the facilities should not be limited to any specific public group. It should be available to all. It should be equally available to all. And the next one is education and training for healthcare professionals. Continuing medical education and continuing nursing educations should be ensured as the new changes and the changes, what are all the changes are there in the new medical field, should be ensured that the proper knowledge is there with the medical professionals. Simulation based training should be done. That means if you have got up with a new machine, what how it should be used, how it should be taken, and how it is used, and what is the function, how the result will be, all the things should be clear to the person who is dealing with that diagnostic uh, machine. And there are specific patient safety indicators for diagnostic process. First one is how much is the diagnostic accuracy that should be assessed, and how much time that has been taken to make a diagnosis or the result, how much fastly the result has come. So if you know the what is the diagnostic accuracy, then you may calculate the error rate also. That means 100 minus diagnostic accuracy is error rate. If out of 100, 90 percentage is the diagnostic accuracy, accurate diagnosis has been made, that means 10% error that has been happened from our hand. And patient outcome will always be patient outcome satisfaction and operational efficiency is always on the basis of the accurate diagnosis. That means the absence of misdiagnosis, and the adherence to the guidelines and audit review should be maintained. That means we have to stick on to the guidelines, and if any audit if any errors are happening, we have to properly uh, note it, and it should be provided in front of presented in front of the audit team. Reporting and auditing diagnostic errors should be maintained. There will be different hospitals have different policies. They will be conducting weekly auditing. Some institutions are conducting monthly auditing, and some institutions are conducting annual auditing. So these all the errors and misdiagnosis should be uh, noted properly. It should be recorded properly, and it should be presented whenever the auditing team or whenever the auditing is happening. Next one is clinical decision support system. DSS provides clinician with knowledge and patient specific information. That means on the basis of the data that we have, history that we have collected from the patient, which one is valuable, which one is important, and which should be avoided, that we have to categorize it. Being the nurses, we are doing such things that we will be collecting the data which is important, that we will be filtering from the data, and we will be proceeding we will be presenting in front of the physician, so that the physician could make the decision and the diagnosis properly and within normal within a limited time. And the type of clinical support system are knowledge based and non-knowledge based DSS. Knowledge based DSS utilizes a knowledge based clinical guidelines, protocols, and rules. There will be specific SOPs, how to deal and how to make the diagnosis. And non-knowledge based DSS is using algorithm. That means if a patient came with a complaint of so and so, if something is there, then we will be going to this area. That means that algorithm will be maintained, and statistical model to analyze the patient data will be implemented in such areas. The benefits of DSS is improved patient outcome, increased efficiency, enhanced safety, standard of care. That means the automatically when we are uh, limiting with the error, when we are limiting the errors in making diagnosis, it will improve the it so efficiently we can give care to the patient. Proper medication, proper treatment can be given, and standard of care will be improved, and the patient outcome will improve automatically. Team based approaches and importance of interdisciplinary team will be should be maintained throughout the patient care. Means whenever the patient is presented, from the time to the discharge of the patient, throughout the time period, proper interdisciplinary collaboration will be maintained. A proper decorum and a proper way of transferring data among the medical team should be maintained, which will be beneficial for the patient safety. So finally, coming to the role of nurses in making diagnosis in different area. Detailed patient assessment. Patient history collection is the main part of patient care. Through the history collection only, we are going to make the diagnosis of the patient. So it is a much important part. Second one is effective communication, which should be maintained, as I have told, within the team members, within the staff members, within the hospital. Proper and effective communication should be maintained for the for limiting the errors and for the betterment of the patient. Monitoring and observing. Certain patients may need continuous monitoring, so the continuous monitoring should be observed. and their vigilance helps in detecting potential problems early, and we can act promptly. Fourth one is documentation. Documentation of specific things that which is needed. That means if any physician has instructed for the temperature charting of any patient, even if the patient have fever or not, the temperature charting should be made as per the time that the physician ordered, so that we can assess that whether the patient is really have fever, or some may be hiding up the symptoms, some may have better tolerance capacity. Even if they have 100 not 2 degree Fahrenheit of temperature, they'll be saying that no, I'm all right. So that part can be missed. So proper documentation, testing and documentation of all other vital data also should be done. Fifth one is advocacy. Nurses are the advocates for patients. It should be done ensuring that their concerns are heard and addressed. And all the things, education and support, all the things related to the patient should be communicated properly with the patient as well as the family members, so that they could understand the real problems, what is happening to him, and accordingly they can act. That means they'll be sticking on to the treatment, they'll be sticking on to the other instructions given to the patient, like diet or exercise, etc. So proper education and support should be maintained. Seventh one is collaboration and teamwork, as we have discussed earlier, and error reporting and analysis. The same thing has been dealt twice. That means we have to record all the errors or the main vital events. We should record, and it should be produced in front of any audit team member uh, on time whenever they are demanding for it. So this is the end of my presentation. I hope you have understand the things what I have said here. If anybody have any kind of doubts, you may please proceed. If anybody have any kind of doubts, any comments you have, you may please proceed.
First of all, I take this opportunity to thank you for giving this insightful session today. Your expertise and your detailed information, what you have given, has helped us in this webinar. Knowing more about how AIs are helping nowadays in the um, healthcare settings, and even how diagnosis actually impacts the health of patient, and what role as nurses we play. All these points what you have enumerated and detailed us was really informative. And thank you, sir, once again for the session, for the expertise knowledge what you have shared with us. And looking forward for more such webinars and sessions with you, sir. So now the webinar platform is open for questions from the participants. So if anybody want to ask, they can unmute themselves and ask the question, or if they want, they can post it in the chat box, so that sir will be happy to answer the question. Any participants would like to come with a question, they are welcome. Sir, I think either the topic is so clear that nobody is having any doubts, or nothing is clear, that is why they don't have any questions. Uh,
So I will keep a question in front of all.
yes, sir, sure.
I think the most of the percentage, that means most of the people from will be from the clinical side. They'll be working in hospital. There'll be minimum teachers in this group. Almost 49 people's, almost 40 participants are there. They are from the clinical side. Will be. Uh, I would like to ask through this very informative. Thank you for the. Okay, thank you, Geeta Mohan. Uh, I would like to ask the people who have attended the webinar that, uh, as per the information that you have got from this webinar, how you are planning how what will be your plans in the future, how will be implementing this content of webinar in your area of working. Anybody can answer, anybody can share their views.
We have got an answer from Ramandeep. That is good teamwork.
Thank you, ma'am. If anybody have any kinds of comment, they can unmute themselves and they can speak in this platform. I have asked that how you are going to implement this webinar or the content of this webinar in your daily clinical works. Patient to make correct and timely diagnosis. Good. Any other comments? Any other recommendations? How to improve? How to improve this patient safety?
Megha Seth ma'am has raised her hands. If she's there, please, you may answer. So nobody is answering. So I would like to take this opportunity and answer.
Sure, ma'am. Sure. By
No
taking
big.
proper history, by improving patient outcome, small scale study may help in identifying errors and ways to afford. Good.
Sir, I would like to explore AIs in medical health. So I would try to search out some new AIs which is helpful in medical team, in medical diagnosis and all. Matlab, I would like to explore that thing. That is, I would say that I would like to do.
Okay, ma'am. So you can search for such kind of applications, and you can get the help of application, and you just implement the things in your ward area, in your work area, and kindly revert me back. What was the outcome of your act? What will be the outcome of your action? Please just revert me back.
Yeah, sure. You are sure, sir.
And I
Sir,
think almost excuse me, ma'am, I think almost all the people will be there in the Nice Delhi WhatsApp group. If you are taking any action, if you are taking any hands on the basis of this webinar and this content, what is the outcome? You can post with picture, or you can just write it down in the WhatsApp and just send it to the group.
mm.
Okay, thank you all.
Sir, I have got one question for you.
Yes, ma'am.
Uh, that is, so we know that in government setup, like in government hospitals and all, we don't have many much such facilities. Even I think in many of the government hospitals, we don't have a proper computer system or hospital information or medical information system. So my question is like, how do you ensure that patient history and previous diagnosis are factored into the new diagnostic assessments? How can we bring that?
Ma'am, if a patient was admitted previously in any hospital, either it might be a private hospital or it might be in a government setup hospital, that means that institute will be providing a discharge summary to the patient on the basis of the diagnosis that the physician was made, and what was the treatment was given to the provided to the patient, and what was the outcome, and the future advices also will be written in the discharge slip. So this thing, that hard form of, that means that hard copy of the discharge slip would be beneficial where there is a lack of such kind of internet facility. That means soft copy facilities are not there, that hard copy could be used for the future references. This is my view. Anyone have any other views, they can share.
Anybody from the participant side who would like to share? No one. Sir, one more question, and that will be my last question.
Sure,
Uh,
ma'am.
Priscilla Rai has unmuted. Do you have any question?
Hello, good evening.
Good
But,
evening, ma'am.
like I'm a staff at a PHC. So as per the situation given by our ma'am before, so in our setup, what we do is that there's a copy, but like we ask the patient to keep one small copy, like the 5 rupees, 10 rupees wala copy we get in the shop. We ask the patient to keep it, and every time the patient comes for the review, we ask them to bring that copy along with them. So in this way, we tend to get into things on the previous medical history of our patients. So in our setup, we do it like that.
Okay, okay. Actually, this was not a question. Ashley, ma'am,
Was
this was the answer for your first question.
yes.
Thank you, Priscilla Rai, ma'am.
Okay, sir. One more
Yes, ma'am.
question I have.
Yes,
Uh,
ma'am.
that is, how like we know that we being the nurses, we can't make a medical diagnosis. We people have the right to make the nursing diagnosis but not a medical diagnosis. But at times where there are situations where we know that the diagnosis being made or the line of treatment being started, there is something wrong is there. So how can we collaborate with physicians or other healthcare professionals to avoid the diagnostic errors followed by the further errors which can occur because of this diagnosis?
Ma'am, in the webinar itself, in the content itself, it was a part that DSS.
Mm.
Okay, so decision making system, supportive system. So, as you have said, we are not authorized for making a diagnosis, but we are the important part of making clinical diagnosis, as we are the persons who is taking the history of the patient. We are the person who are collecting the data. We are the person who is regularly going to the bedside and giving medications and doing all the cares. Through that way, what are all our observation that we can communicate with the physician who is present on the duty, which would be helpful in the process of patient treatment. And that in some cases, if there is a misdiagnosis was made, we can keep our views, we can keep our suggestions, whoever it may be. It might be a doctor, it might be a nursing staff, or whoever it may be. We can keep our suggestions. In such way, we can reduce the risk of errors, or in some time we can act accordingly off records.
Okay. Thank you so much, sir. I think the participants has no more questions, and I too don't have much more questions related to it. So I think we can conclude the webinar here. Once again, I extend my thanks to you, sir, for the wonderful session you have taken. And I especially thank all the participants here who have taken time out of their schedules to attend this webinar. And I hope this session will be helpful for you in your clinical areas, and you will try to implement some of the parts of this session into your daily routines or in your daily works. And at last, I would also like to thank the ISICN team also for giving us this opportunity and providing us this platform to have this webinar session today. So once again, thanks to all, and bye to all. Thank you.